10 conditions. Fibromyalgia is often mistaken diagnosed. It is not uncommon to misdiagnose fibromyalgia as another disorder and vice versa, as many fibromyalgia symptoms are very comparable to those of other diseases. A test was created only lately, and many physicians are still unaware of it. People with fibromyalgia will also often have one or more overlapping circumstances, making diagnosis more complicated. Here are 10 frequently mistaken circumstances for fibromyalgia. Syndrome of chronic fatigue. The disease most likely to be confused with fibromyalgia is chronic fatigue syndrome, also called ME/CFS. Since an estimated 70% of individuals who have one have the other, that's understandable. Each of the symptoms is extremely comparable. So much so that some specialists think that fibromyalgia and chronic fatigue syndrome are expressions of the same fundamental disease slightly distinct. Syndrome of hypothyroidism. Hypothyroidism is a disorder where there is not enough thyroid hormone produced by the thyroid gland. This is another disorder which shares the symptomatology of a lot of fibromyalgia. Some common symptoms include joint or muscle pain, tiredness, cold sensitivity, constipation, depression, and gain in weight. Syndrome of lupus. Lupus is an autoimmune disease, meaning an individual with lupus immune system will attack ordinary cells as if they were invaders outside. This can trigger inflammation, tissue harm, and body-wide pain, which feels much like fibromyalgia's prevalent body pain. While there is no single test to determine lupus 100% of the moment, laboratory tests are available to assist your doctor determine if you may have lupus. Syndrome of osteoarthritis. Osteoarthritis is usually triggered by age-related cartilage deterioration in joints that can result in harm to the tissue and bone. Fibromyalgia-like symptoms include joint pain and stiffness in the morning. A physical examination and a range of diagnostic tests can be useful in creating an osteoarthritis diagnosis. Syndrome of rheumatoid arthritis. Rheumatoid arthritis is an autoimmune disease causing inflammation and destroying the joint lining. Symptoms of rheumatoid arthritis may have pain, exhaustion, sleep disturbances, depression, and anxiety in common with fibromyalgia. Rheumatoid arthritis can be hard to diagnose as blood work and X-rays can demonstrate ordinary outcomes for many months after joint pain starts. Syndrome of multiple sclerosis. Multiple sclerosis is a disease in which the immune system of the body eats away from the sheath of myelin which includes and protects the nerves. This affects the ability of the brain to communicate with the rest of the body. Pain, fatigue, numbness, tingling, cognitive impairment, poor coordination and blurred vision may be common symptoms of fibromyalgia and multiple sclerosis. Syndrome of depression. Doctors have been telling individuals with fibromyalgia that they are just depressed for years. Although depression is often listed as a symptom of fibromyalgia, clinical depression is in fact a separate and different disorder that sometimes overlaps with fibromyalgia. Some prevalent symptomatology involves memory and concentration pain, tiredness, and difficulty. Syndrome of Lyme disease. Lyme disease is triggered by spreading bacteria from a deer tick's bite. Fibromyalgia is often misdiagnosed with chronic Lyme disease. Why? Many of Lyme disease symptoms imitate fibromyalgia symptoms such as muscle and joint pain, exhaustion, headaches, behavioral impairment, and digestive disorders. Lyme disease can also be very hard to diagnose correctly, as many of the blood tests used are unreliable. Syndrome of sleep apnea. Sleep apnea is a disease where breathing stops and begins constantly during sleep. This can lead in many of the same symptoms as fibromyalgia, including unrefreshed sleep, exhaustion, itchiness, headaches, and cognitive issues. If a patient with fibromyalgia is discovered to have sleep apnea, other symptoms will also be significantly improved by treating the sleep apnea. Syndrome of polymyalgia rheumatica. Polymyalgia rheumatica is a type of arthritis that creates muscle pain in many areas of the body and rarely happens in people under 50 years of age. It shares some of the most prominent symptoms of fibromyalgia: pain, itchiness, stiffness in the morning, and exhaustion. Stay healthizes. Thank you for watching this. Please do not forget to subscribe, share and like our channel. Click the bell icon for latest update.